In the name of Harvard, Oxford, and HEC Paris Alumni Networks, we welcome you for this joint conference about Positive Deviance approach with its co-creator, Monique Sternin. I first discovered Positive Deviance in the HEC-Oxford Master, Consulting and Coaching for Change. And then I learned more in the Harvard Business Review article, which have been written by Jerry Sternin and Richard Pascal, an Oxford fellow, which is called Your Company's Secret Agents. And then in the 2010 book published by Harvard Press, which is called Positive Deviance Approach, How Unlikely Innovators Solve the World's Toughest Problems. Then I created the opportunity to study with Monique and to go deeper through Monique networks in Asia and especially Cambodia fields to discover about infant malnutrition in real situation. And it led to this conference. It led to a couple of articles in Challenge magazine in October during the Women's Forum. And starting today, and one per month for 3 months, in Harvard Business Review France, we've got a series of articles about Positive Deviance approach. So for me, it was very important to share the knowledge that we gathered at HEC, Oxford, and Harvard with you. And I will ask a couple of questions to Monique. Then I will open the debate with you because, as some of you know, the basics of our meetings are conversation with somebody that we say in French, remarquable mais pas toujours remarqué. And first of all, I would like to ask Monique about positive deviance, which is a qualitative approach with quantitative data. So, what are the key figures you could share with us regarding the key figures and the data of Positive Deviance approach, please?
Okay, so it actually has had some impact, and I will share first a few figures from the public health sector. And as you have seen maybe on the slides, this approach has been widely used in trying to rehabilitate malnourished children and has been very successful with about 65 to 80% sustained. This is a word that's going to be important in this working with you. Sustained rehabilitation of malnourished children in about 41 countries. Another application of this approach in public health, there's been many, but I just chose some that related a bit to the slide that you saw. In Pakistan, you saw that woman and that newborn baby. It was also sustained reduction of mortality and morbidity of newborn in Pashtun communities in northern Pakistan. And well, if you have questions on that, we can talk about that. In business, this approach, business is not my field, but it's okay because I am an expert at being a non-expert. And that's very important in this approach. But in any case, in business, where I'm not an expert, the approach has been used successfully with different companies, but I'll mention only Merck Mexico, where the approach was successful in bringing Merck Mexico from last to first place in the Latin American League regarding the sale of a drug called Fosamax. They were the last, and within a year they were able to completely reverse the situation and sustain their gain in their sales of Fosamax. In what field? In education, in Argentina, for instance. So this approach is used a lot in education, serious issues. So let's say in Argentina, in Misiones province, where 50% of primary school children did not drop out by 3rd grade. This approach was used in collaboration between the Department of Education and the World Bank, and was successful in 2 districts of improving, increasing children's retention in school by 50%. What other field I could talk about? Closer to you, so Europe. So let's say if we look at the justice system, this approach has been used widely in Denmark, in prisons. And you think Denmark prisons are like, what do you call, 5-star hotels. But they still have problems. And using this approach, they were able to reduce tremendously absenteeism among guards who were faced with the stress and violence events, daily violence event in the prisons. What field can I use? Child protection. Well, that's another field. In child protection, this approach was used in Egypt to advocate against female genital mutilation, and was instrumental in saving thousands of girls from excision, from being circumcised. I forgot a very big one, which is a bit similar to your world of business, is in the US, the use of the approach was used in nosocomial infection eradication in some over nearly 100 hospitals, and particularly in the Veteran Administration Health Services, the VA system, which is the largest network of hospitals in the US, with 257 hospitals, both acute and long-term care. And there they were able to reduce transmission rates of something called MRSA, which is one of those bacteria, virulent bacteria, by 62%, virtually to 0, and maintaining that very, very threshold level till today. What else? I said prison. I said that's enough.
Yeah, definitely. So
there are many more, but I don't know them all. And all those are documented. You can go on the website and read all the articles.
So you are saying to it that you are an expert of not being an expert. You are French. You come from Paris. You've got an English degree from Paris University. Then you went to the US and you completed your education at Harvard University, and on education. And then you met your late husband, Jerry. And then you moved to NGO action. So based on your experience, when did you and Jerry become aware of your action's limits in NGOs, which led to Positive Deviance approach?
Okay. So so my experience with this approach is mostly on sustained development or development, international development. And we had been with my husband working in Bangladesh, lived in Mauritania as well, but also in Bangladesh on very difficult issues and being somewhat successful. But we noticed two things. On the negative side, we noticed that the NGO mentality was actually creating dependency on the beneficiaries of their work, which is still happening today, where you have groups of people you work with and you maintain that dependence, whereas you're supposed to solve a problem and move on to something else, but really let go of your beneficiaries. It's a little bit like consultant, and I don't know how many of you are consultants here? Oh, because that's the thing with this approach. You have to let go. The purpose of this work is to become irrelevant. Same with NGOs. We're supposed to become irrelevant. The problem is solved. We move on. And as a consultant, we try to move on. One of the challenges of this approach is when it works, they say, thank you, we don't need you anymore. And that can hurt your business plan or your business model. So we were in Bangladesh and having some success, but also seeing the limits of this type of work. On the other hand, we were privileged to meet ordinary people who were extraordinary. not like, but in one field. Let's say if we had savings groups, you could find extreme situation where a widow, a very poor woman, no education, no literacy, nothing, was able actually to create a business, be a very good entrepreneur. And so through our experience overseas with this very severe and extreme situation, finding this individual, we developed a very humanistic approach to life or issues, and we were convinced that sometime, instead of looking at what already works, NGOs and the likes and all of us are very eager to help people, to provide our expertise and skills and help people. And in a way, we prevent those treasures, those nuggets of gold, those people who have the skills to do everything, from emerging and being recognized and particularly leveraging their skills, their behaviors, their strategies that are sustainable because they're already there. So that's what led us to Positive Deviance.
What was the turning point of your story?
Turning point of my story.
I lead you, Vietnamese.
Oh, okay. So, oh yeah, okay. So we had this sort of idea. We said, well, the work we do is not really sustainable, but solutions are right there. But somehow we haven't found a way to capture that. And then we were given the opportunity to actually try to do something about this, this issue that we felt when we were asked to work in Vietnam. You want the whole story of Vietnam?
I think they want the whole story.
Who knows the story?
We don't know it. No.
Nobody knows the story? Oh, okay. First of all, you can watch it on YouTube. But anyway, a short... No, it's already 7:30. I want to make you laugh, and this is very important. But in any case, in a nutshell, we were asked by the government of Vietnam in 1990 to, the organization we work with, to come and develop a model to sustainably rehabilitate malnourished children. Malnutrition at that time in Vietnam was very high. Even the ministers were malnourished, I could tell, because they were in transition period and they were not producing enough food to feed the people. And anyway, they had typhoons, so their harvest has been decimated. There were many circumstances that actually showed that the country was on its knees, and it was near famine situation. And not only that, but the government of Vietnam at that time was not that eager to see I'm also American, organization come to Vietnam. They didn't know about a non-government organization as a communist country. And so they told us, we arrived there, and they said, listen, you've got 6 months to develop this program and show impact, otherwise your visa is not renewed. So you have to understand that my husband and I, of course, French-American, but we don't know anything about Vietnam. We don't speak the language. We don't have staff. We don't have an office. We're not nutritionists. We're not expert in nutrition either. So what can we do? We have this 6 month predicament, and what do we do? So what we did is actually this positive deviant business that's a bit jargony, and some of you may not like it, but it's just think of it as looking at what the few people who are different with a good outcome. We turned to actually a book that had just been written called Positive Deviance in Nutrition, for Positive Deviance for Childhood Nutrition. That was a collection of surveys or research that had been done by nutritionists, specialists, scientists, who had studied populations that had high level of malnutrition, but where they always found a few children who were healthy. But not only that, but they look at the few children who were healthy and belong to very poor family. So looking at solution in worst case scenario. So we're not looking at heroes or the outliers according to Goldwell, or we're looking at worst case scenario and yet solution exists. So we read the book. The book mentioned at the end that maybe there should be a sort of a operational application of this concept of positive deviance. And so when we were in Vietnam, we didn't know what to do. We said, okay, we asked the government that was with us, following us everywhere, what if they're giving us a population, 20-some thousand people, 4 villages with about 2,000 children under 3. That was the target group that we had to work with. And we said, what if we looked at the problem differently? We put new lens on and said, what if we looked at very poor family who had well-nourished children? Because evidently then maybe we can find out what they're doing. And they said yes. So evidently nothing would have happened if they said no. Vietnamese are evidently a country that has suffered a lot and are very self-reliant, so there are cultures that are like that. And it appealed to them. And we said, well, let's go and find out. So we did. Another thing, we had no tools. We just rent an old Russian car and an interpreter because we don't speak the language. So what did we do? PD is an asset-based approach. We said, well, we can't do much here, but we're going to engage all the existing human resources that are there. And in a communist country like Vietnam, we capitalized on communism because they actually have lots of silo organization. You have mass organization like the Women's Union. You had the Ministry of Health, of course, that you have to think about. And then, of course, the Communist Party is always there. And then you have the Farmers Union. So anyway, you had organization that existed at the grassroots level. But they had never worked before together on the issue of childhood malnutrition. So all we did as catalysts or something is to bring together this silo organization. I hope that gives you a little link for your own work, where to try to bring them and create what we call horizontal networks. Bring them together and for them to identify the problem, look for those so-called positive deviants, this poor family, and then together discover what they were doing. And we were lucky they were there. I can tell you the story, right? And we're able to discover what they were doing in different area, and feeding, caring for the child, and seeking behavior and hygiene. And there was something, anyway. And they said, well, now so that we found those solutions and common behaviors that threaten the status quo. They're taboo. Food for young children. Like you have taboos in your organization. There are always taboo protocols that you have to follow. But positive deviant, sorry for the jargon, they always do something different. They challenge the status quo. They do something that goes against the grain, against the general culture, the protocol, whatever you have in your organization or businesses. And so, but they did something different with a good outcome, which enabled the people to be willing to adopt. I jumped. Anyway, so it was successful. We were able to start rehabilitation. They were able to start rehabilitation by setting up an activity that would enable the people with malnutrition to act, not to learn. PD is not about knowledge. It's about practice. We say in our jargon, it's easier to act your way into a new way of thinking than think your way into a new way of acting. I think that's difficult in the context of French culture because we're very abstract. The way we speak in French is we use abstract words a lot. That's our culture. But anyway, we wanted the focus was emphasis on action, doing it. And by doing it, you actually change your behavior. And it was successful. We got our visa. I talk too much. And we got our visa. We were able to expand. It was successful. We didn't do it too much. We were able to then, through structures that are already there in Vietnam, extend this particular approach that we call the PD approach then to 5 million children in the country. That's it. So
could you give us examples of things, actions, behaviors that you discovered amongst the positive deviants? Because we know the story, but Have you got any information that you could give about that?
So again, the taboo food that they were feeding their children, they were feeding their very young children shrimps and crabs, or eels, or escargot, snails from the rice paddies. And that's food that you don't try to feed young children. They were also feeding, at the time, the common practice. People were very busy. They'd just been given land to farm. And so they had to leave their children with all the siblings, and they ate to work. So the children, the whole family was fed only twice a day. But these other people were at different strategies. They made sure that their children ate. It was not so much it was the same amount of food, but in 3 times a day. Very simple strategies. And because older siblings were looking after younger, one, because the adults were busy trying to farm, to eat, they were given advice on how to care for the children. And there were also scarcity of water. People had to, this very poor family, I tell you, they were so poor. Sometimes they didn't have 4 walls in their home, and they had to access water very far, but they had strategies. In many countries, you will see in very simple, but again, uncommon strategies to overcome many types of problems. Do you want me to talk more about uncommon strategies?
I think we will. I think we could talk more, but we are more from the consulting world, the French world. Why in extreme situations that you talked about, why external best practices are not efficient?
Or because best practice is one size fits all. You apply, but life is, I mean, you have to adapt to the local context. And sometimes best practice tells you to do this, but they don't tell you how. It's not the what. Feeding your child, or I don't know, I can't give example from business because I don't know, but having this type of behavior, which we know is best practice, but how do you actually practice your best practice in the context of life? I'll give an example more from hospitals. Hospitals are businesses, actually, because the bottom line is making money, in the US at least. So a problem like MRSA, you take a specific problem that hurts the bottom line, profit, because it's expensive to have cases of nosocomial infection in your hospital. So there are protocols set up by the CDC. You heard about CDC because of Ebola, whatever. So there are guidelines, the best practice for infection control. And you're supposed to, each hospital is supposed to follow those protocols, their best practice. But how do you actually manage to, let's say, keep yourself secure and protected when you go into a room where there's isolation room, where somebody has what we call a cardiac arrest, red code they call it. So all of a sudden life is not, perfect situation. How do you actually adjust to that? How do you do when you have to rush into a room to save a life, when you're supposed to be putting on those gowns and go through this very elaborate, very good best practice protocol for infection prevention or control? So again, the difference between best practice and PD is not about the what, it's the how. How can you actually be able to practice those so-called best practice
and
in a local context?
Who in the hospitals were the positive deviants that you gather information from?
Well, we haven't talked about how it works. So this approach is just like a template. I could give you the basic methodology, but you have to adjust it to many different types of context and environment. Evidently, the villages that I talked about that you saw on some slides, and hospital in the US are, well, you said they have nothing in common. Actually, they're all communities that regulate. Those of you who are involved in organization change know that there are rule of culture, there are social protocols, lots of dynamics going on that are actually not that dissimilar. In hospitals, there's a lot of hierarchy. And the question was?
I think that I was wondering.
Oh, who are the people? And how are the people? There were many types. First of all, positive deviance, when you try to look at what works and who are the people who are so-called agent, not agent of change themselves. They don't know that they are different. They're doing something different. And if they know, they won't talk about it. In a hospital setting, can you believe if you do something different from your protocol? It's the most hierarchical, the most constrained environment where you're supposed to do this, this, this. And you have experts who tell you and check on you. But the people who are successful, they escape, they do something different. In hospital, they could not say what they were doing. They just have an idea. Because if they said, they would be, yeah. It happened in business too. There's a law of you have to conform, and you won't tell what you're doing. So there were many positive deviants from different sectors, because that's another problem, the complexity of the issue. We don't work in simple problems. So this particular problem of nosocomial infection, the virus can be everywhere. It's not limited to the surgical room, the surgery room, or to special units. It's everywhere in the hospitals. Because, yeah, it's on any surface. You can take it. There are many movements of people in the hospital, even people who are colonized or people who have infection are carried around. So very complex, like the world you live in yourselves, very complex issues. So there were positive deviants in many sectors. What the process of positive deviance does is to bring all the stakeholders together. We go well beyond the usual suspects. And it's hard at the beginning. Are you crazy? You're going to bring everybody? I say, well, yeah, well, I'm in a hospital. If the thing is everywhere. So from pastoral care, the priests or the religious people who bring the Bible from bed to bed and spread the virus, to the cleaning people. They're more important than surgeons. They clean those rooms. So finding the people who do something differently from many different sectors. The assistant secretary, I don't know, who type on key, you know, but now we touch. The keyboard is one place where lots of germs. So you cannot, and the CDC, we had a grant from Robert Johnson, so people who looked at us like, what are you gonna do this? And they thought we were a bit soft. PD looks soft. Because what we say, okay, we're going to invite the community to define the problem. Then identify the people, the group, the departments who are different. To define the problem, you need data. So you have to first reframe the problem, make sure you take a problem, a concrete problem that relates to the bigger issue. Because if it's communication is the problem, well, I mean communication. It's too vague. So you have to take like a laser beam approach to say what is a specific problem that relates to this big problem of communication. So in hospitals, the issue, for instance, that one hospital took was they had many people were readmitted in their hospital because they're not taking their meds properly. It's a hospital that caters to older people, and so they had a hint that they needed to, that there was a big problem and they didn't know how to it was a communication problem. Because people don't take their med properly, they can die. So they took that particular problem. I use issues as big things and problem as something specific. And they applied the approach to a specific problem and discovered what worked. So going beyond, answer your question, there were many types of positive deviance.
I thought about the janitors who told the doctors what to do.
The janitors, oh yeah. Well, that's social change, that's transformation. So this approach is about solving problem, looking at what already works and leveraging what works. But the process of doing that transform the whole community through processes that take place and facilitation. And in that, your example is that in that one hospital, well, actually worked, it changes the dynamic. It's a very democratic process. So a janitor, as you said, was able to conduct a weekly evaluation of what was happening in a certain unit regarding transmission of MRSA. We're going all over the place. How are you doing? Do you have questions? I don't know where I am. Are you okay? Maybe I should say how simple. It's not so much the people as much, well, you have to find the people or the groups. And the difficulty is, we call that a PD inquiry. It's actually finding what they do, again, because of the law of silence, or because they just don't know, they're not even aware what they do. And this inquiry is a very complex, I mean, it's difficult to do, because you have to probe and find out what people are doing. What you find out, so first of all, you find from those people themselves, because from some data has identified them as being different, with a good outcome, while with selection criteria, they cannot be somebody who has a friend in the other department or access to special resources. We take worst case scenarios, where people are still successful despite the situation they're in. So you discover those people, and you select them. The community does that. And then they discover what they do. And some are exquisitely simple. I mentioned the one in Vietnam, but I could mention in a very difficult context, for instance, in prison in Denmark. First of all, you interview the people who are different, but you also expand the solution space by talking to the other people they interact with. So in the prison in Denmark, the problem was absenteeism, as I mentioned. That's a data one that was due to a lot of stress and violent interaction between the guards and the inmates. And they also interviewed the inmates to find out who the PD, so-called PD guards were, the guards that had a better relationship with the inmates and help inmates manage anger. And so you identify those individuals from different sources. And actually the one I want to talk to you about came from, I have another one, but came from the inmates themselves. He said, this guard is different. Actually, it was a woman, female guard. When she comes to the door, the protocol is you cling, ling, 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 ling with a key or with your chain, and then you don't knock on the door, evidently, but you just open the door to get into the inmate room, and you just go in. And they say, no, that female guard, she's different. What she does, I don't have my keys with me, she gently wiggles her key to let me know that she's going to come, and she knocks on the door. So you say, well, I mean, nobody would think about this as being that important, but it was important for the inmate, evidently, to create this working relationship with guards and prevent episode of violence. But the guard herself would not know that what she had done, that this particular behavior was very important. So what are the simple things I'm trying to see? Simple behaviors. Well, there's one that I'm going to ask you about, actually. This happened, and I don't have much detail about it, but it happened in the Balkans during this civil war. I don't know if it was Serbia or in Croatia. But anyway, there was a civil war between different factions, Muslims and other groups. And so you look at the map. There's a lot of mapping in using Positive Deviance to find out. And the question is, I mean, with all this village warfare, civil war raging everywhere, are there communities who are not fighting, where there is no slaughter? And when they looked, they found that there were few communities when there was no fighting in having both population of Muslims and other groups together. And so I'm asking you, what do you think those people did to prevent slaughter and warfare in their own communities? Any idea? What do you think? Huh? Yeah, everybody knows, but that's the thing with civil war. They all were friends before, you know. Yes, so they knew each other. Of course, they knew each other. But what was that strategy that was... I'm asking.
They married each other.
They intermarried before, yes, of course, but that didn't prevent other villagers with intermarriage to just...
They carried on talking to each other.
They carried on talking to each other, yes, probably.
Maybe they shared the land or the property. Shared ownership.
You're getting warm. There's an important word here, sharing. Anybody?
Business together.
Yeah?
A business together.
A business, I mean, it's still civil war, so it's very hard to...
It was already civil war.
During the civil...
They were sharing meals?
Sharing... Maybe they were sharing meals, but they shared something much more precious. We're getting there.
Water?
Médicaments?
No,
Water?
no.
The church?
Church? No, because... no, what's very precious to people?
Blood.
Children. So I'm giving you the example. They share their children. That is at night. The families from this particular ethnic group would send their they knew each other. You all, but what they were actually exchanging their children because the slaughter, I mean the murder, and the people were coming at night. So they would ensure that their children would be safe by exchanging their children at night. So again, this is just an example of the simplicity of what people, of solutions. Very simple, easy to adopt, low cost, affordable, and indigenous, which is very important, contextual, and sustainable because they're already there in the middle of the war. And what else? What else are they?
I think it's a good example. So you are not used to be the center of attention. So I thank you so much for explaining things.
Yeah.
And keeping a time frame is not...
Yeah, because we didn't answer all your questions.
Yes, but I think they will ask questions.
Oh.
What would be the leader's talents from positive deviance lens?
Yeah, that's a tough one. Because again, the processes, it's a bottom-up approach. It's the community, frontline workers, middle managers who take over. So the leadership in this particular case, again, positive deviance is used in extreme situation for problems that are very complex, where expert-driven, you all hear. Experts have tried to address and have not been able to solve. And there's a good example, I don't think Greg Levy is here, but there's a good example in France. I would say example of in your business community would be this example of a large semi-public garbage collecting company in France that had seen accidents on the job accident. Huh? Climbing. They call all the best, I don't know their name, but all the best consulting people to help them fix the problem. So they all go to this beautiful building outside outskirts of Paris, and all the big managers, everything. They talk to these people, talk to them, and they say, well, I mean, you add cameras, because, you know, garbage collecting is a dangerous business, actually. So you add these features, so technical approach. PD doesn't work with technical approach. But so anyway, but when you exhausted technical approach, they tried everything, putting this, changing that, nothing worked. And came Greg, who is not here, but he should be here, because it's nice to say that PD is here in France. I mean, it's everywhere, but in this particular case, he asked, but have you gone and talked to the people who actually do the job? Bottom-up approach. They said, no, why? I mean, they don't even speak French. I mean, they're people from, I mean, why would you go there? They said, well, I mean, that's where the accident takes place. And then he also looked at the data. So to go back to the leadership role, you have to, and then he started working with the grassroots level people, the community, the people who actually are the one who face the problem, are the one who have to solve the problem. From the leadership point of view, for this particular extreme situation where nothing works and you come to the PD approach, the role of leadership is different. The leaders are just catalysts for bottom-up change. They have to remove barriers. They have to help with logistics, time frame, because this type of processes, as you probably know, it takes time. You need to be able to access the workforce, the managers, or wherever they are. And so the leaders are facilitated in that particular, to use that approach. And they have to actually let go a little bit. They have to let go, but at the same time, because what is found challenges statu quo. For Merck, Mexico, they had their marketing secret code. I'm not going to divulge it here because we're not supposed to. But anyway, there was, among the marketing golden rule, there was the law of 7. You have to make 7 calls to your clients, the rep, the sales rep have to do that. Well, evidently, the people who were successful at selling Fosamax better than everybody else, they never used that rule. They were doing something very different, threatening Merck core principle, Merck core marketing Bible. So go back to the leadership. The leadership needs to, because it's a dangerous business. It's very dangerous. When things change, you give more power to the people. You remove your own control. You let go, you let the people discover what works, and when what works challenges your set of principle, whatever, the leadership needs to be there. So leadership withdraw, let go, but at the same time at key milestones in the process. They need to be there to reassure people that it's okay. Otherwise, those findings cannot be leveraged. Evidently, that would create change. Well, change within the community. And so they need to be the safeguard in a way and say it's okay. And what else do they have to do? They have to be different, that's for sure. And the problem with that is one of them, I met the director of sales at Merck, Mexico, and he said, you know, I cannot go back to my old leader style, because now everything got loose. So it's for some people it's a bit dangerous, because then it's a community that takes a lot of initiative to fix problems, and you cannot go back to an older leadership style. It's a bit different from the standard model. You know the standard model? Oh, I don't know either, so I won't talk about it. But apparently, and it works very well. You know, it's top-down CEO, and then directive come from above, and everybody trickle-down effect goes down to the pyramid goes like this. The workers are here, and it comes like top-down. But with this approach, you reverse it. It's a bottom-up approach. And so, yeah, it's dangerous business.
So you talked about unexpected and very efficient solutions that you wouldn't have found from the external lens, like the families exchange at night. And I know that there is a main journey after Vietnam, which is in Egypt, about female circumcision, which is quite insightful. Could you, with all the time you want,
you must be bored.
Talk a lot.
I want to know
more. If you want to share, you are the master of the process.
So the way we did it is not from concept, except this idea that solution to very complex problem already exists. And it's not an idea, it's an observation. And if you can remember that tonight, sometime when you're there already, and you're supposed to, as coach and as a consultant, to come, and you're supposed to have the solution. People saying, but you're in charge. You tell them what to do. I said, I can't. So it's a very complex situation, very difficult for those who apply it. But if you can remember this, is when you're in an extreme situation and you say, I don't know, I have to find a solution. You stop and say, I'm going to look, I'm going to ask, is anybody here, has any department, is this situation's been overcome, have been prevented, anywhere in the system? And so that's what you should remember. But now you wanted to, what? Oh, FGM. So we didn't start with any, except for the concept. And you know, remember sustainability and creating independence, letting go, let people actually do their, develop themselves. After Vietnam, we said, well, this works. And we thought, well, we should apply it somewhere else. What we did there, which didn't, could it be applied somewhere? So we actually moved to Egypt, just happened this way. And in Egypt, we looked for an issue, a problem where we said, what if we tried a few things we did in Vietnam on another problem to create patterns. So PD is about patterns that repeat themselves. That's why we can say there is a PD approach in a way. But it's very flexible. It's not, as I say, it's a template. It's just, so in Egypt, I was in contact with a task force, an Egyptian task force that worked on the problem of female genital mutilation. And it's an advocacy group with many, many people who've been working on the issue for a long time. It turns out that in Egypt, from at that time, the latest statistic they had that came from 1992 district health surveys, that 97% of ever married women in Egypt are circumcised. So this is near universal. And so these people have tried a few things. They were doing what they could. They had some advocacy activities, but basically they were overwhelmed by the issue. And so we tried to think of this in a different way. So what would we say if we look at data and we say 97% of women are circumcised and I'm supposed to do advocacy? What would be a PD way to look through different lenses? Huh?
You look at the 3%?
The 3%? Yeah. So in Egypt, that's 500,000 people. Women that are not circumcised. Well, some of them were not circumcised because they're mentally or physically handicapped and could not get married, so that takes a few away. But yeah, exactly. That's what you do. Well, I mean, it was not easy. But anyway, so we said, can we do something? We had a lot of people say, okay, do a study. Evidence-based. Everything has to be evidence-based. Prove that there are people who said no. Prove that some people are not circumcised because somebody in their family or their environment said no. And withstand the pressure, I mean, to get the girl circumcised, because this is what you do. And people say, no, you just do a study, do a PhD, whatever. And I said, well, I'm not going to be in the country for a long time. Is there a way, again, PD is very practical, huh? How maybe we could try this to find out those so many people. And so finally one organization was willing to try. And we started with, I had a group of people working with me. Evidently being a foreigner and everything in a very sensitive issue, I had talked about removing yourself, being invisible, was very important, but I was able to work with the team. And we started with actually a Coptic organization in Beni Suef. And well, at that time you couldn't talk about it. It was very dangerous. Many NGOs said we cannot touch this because we'll be killed. I mean, the tension was, it was really a taboo topic and very controversial. So that very courageous nun was the head of this COST organization, said, no, I've been trying to do advocacy. I want to try. And so we did. So we met in a monastery. We had to hide. And she came herself, so everybody was involved, all her staff, and their partner organization who worked in the field. And so we got together and over 2 days or 3 days to figure out how to do this. And again, the pattern emerged that the problem was not the community that were doing the cutting, but it was the advocacy group that didn't know how to advocate, actually could not advocate. So the idea was to find people in the community where they work who had said no to this practice, that refused to do it or had renounced it, had stopped doing it. So there are many types of people again, a very big, large group of people. And then we trained them to talk to them. It's a very sensitive topic, so we did a lot of role play. We laughed a lot, because laughing is important in topics like this. And then they went, and up they went, and 6 weeks later they came back, And they came back with people. And I said, wow, yes, we found people. And those people led us to other people, because we had a very simple, so the tool for positive deviance are usually simple, but it's the people who create the tools. There's a lot of observation, a lot of interview types of things with probing, but they had created their tools, and then they came back with more people. And what had happened, and we had no idea, but in this interface between the advocate who could not advocate and ordinary people who had said no, there was transformation on both sides. For the person who could tell their story for the first time, they became empowered to say, I'm going to join you. I'll join the advocacy group. I will go and tell my neighbors, my people in my neighborhoods about what I've done, because they would have the support of the NGO. And for the advocates, NGO staff who could never talk before, to find those people who had the courage of their conviction and who had done something extraordinary, propel them to change, and they change immediately. So that's an aspect of that's amazing. He had asked me questions. What's amazing about this is like things happen that you are unthinkable, that you never thought would happen, and we didn't know. But they had this transformation on both sides, which was captured and leveraged at individual level, community level, NGO level. And all the things that those people were saying, of course, in advocacy, there's the way you talk, the way you convince people. So in Arabic, the way in different parts of Egypt where this was done, there are different local vernacular. So language is very important in this part. You want to not talk about, because language is power. And so when I hear words here, I'm like, I don't know what they're talking about, particularly your group, because you have lots of learning. You're very experienced people, and you think you get a lot of theory, and I'm like, oh my God. When you work with people, you've got to change, really, we have to work a lot on our vocabulary to ensure that we don't demonstrate power and control or knowledge, but that we use local vernacular. And in this case of advocacy, they were able to gather all those behavior change communication messages that were so powerful and had been successful at preventing girls to be circumcised. And some of them would be like Allah has created our body. God has created our body, and he made it this way, so you cannot change what God has created. Another one would say, and in Arabic it's a very strong term of this act of il-khitan, of excision, is actually like butchering the girls. Or there would be a girl who has convinced her mother not to circumcise her by saying, you want me to be modest. You know, modesty is very important in many cultures. In rural Egypt, girls are supposed to, you know, they wear long clothes, they cover everywhere. And you said, you take me to the dye or the butcher, or I mean to the guy who circumcises, or a doctor, and you let me open my legs to look at me. How can you do that? So for the parents, anyway, so very demonstrably successful, powerful ways to convince people not to circumcise the girls. So when we did this work, then we realized that, there's something here, the way we work. There are patterns that repeat themselves from nutrition to FGM, and then to different fields. That's why you could see how this has been applied to many contexts. But it takes many forms. In a hospital, they do what we do in a week in a field in developing countries. They do it in 45 minutes. They call it discovery and action dialogue. So they develop tools that are brilliant, but they fit exactly what hospital staff has time for, because, you know, time constraints. So and then it works for them. And it's an iterative process. So they use it very differently of the way it is. And again, tools. You can even use appreciative inquiry. The way you use this approach is you can plug in many other tools that are that are familiar to the community you work with. So in the developing world, we use what we call PLA methodology or PLA activities, participatory learning and action methodology. We work with people. I think a lot of people are, it's coming to the West now, everybody does mapping together. You probably know all those tools. And, but we use tools that are appropriate to the context. A big issue with PD is network mapping, network weaving. You want, again, remember the silo organization, how sometimes you are asked to come to change the culture, to create team approach to work. These are abstract things. So with this approach, you take a specific problem, but through this problem, you look at how people are networked. So in hospitals, there's a software called network mapping, where they can analyze themselves who are the connectors in your organization or hospitals that people go to for this particular problem. And they realize this is not the specialist or expert, let's say in this case, of infectious disease control. It's not those people, experts, that people go to. Actually, they go to a woman somewhere who is more, that they go to get advice. So they get a mapping, so you can use this kind of tools of making a baseline of the networks that are used in a hospital. And then you can, months later, because we look at impact, I forgot to say that measuring progress is also part of change. Because as people try new things, as those uncommon behaviors are being leveraged and used by whole, you want to make sure that it impacts on the problem. It's not just something. So you can use network mapping as a baseline and then come back and see how that, I don't have photos of it, slides, how the network has been changed and how people are more interconnected. They didn't do it through trying to create teamwork, change the culture. In PD, we never try to change the culture. We change the culture by not engaging in behavior or trying to change the culture. We take a problem that everybody wants to change, to solve. It's a very concrete problem. It's not an accident that the problem we deal with are very often life and death situation or very serious problem. For Merck, it was not life and death, but it was a profit. I mean, for Merck Mexico to be the last and losing sales was hard on the bottom line as well. So taking a problem that everybody's concerned, because the survival of the frontline workers is also has to do with the bottom line, right? And try to, through this very concrete problem that everybody agrees to look into, look at the solutions, and then by doing this whole process of engaging everyone learning from each other, and having the leadership letting go, it signals to the frontline workers that they can innovate, that what's happening, they innovate anyway, but the leadership needs to be there to say, yeah, it's okay, you can innovate. And everybody, but measuring the progress is very important. That's so you can link these processes that are taking place in the organization to actually the impact figures. Another aspect of that is the measuring is not coming from outside. The leadership, the senior management can have their own indicators of success. And we always say we will deliver on your definition of the problem and what you want to achieve. But it will be the community or the people in your organization who would design their own monitoring and evaluation indicators. And they may be different, but we want to also give them the tools to measure their own progress. Because that reinforces change, because they think that they do something different with a good outcome, so they're more likely. It's like us. If I want to lose weight after the holidays, I go on the scale, and then I do something different, and then I go back on the scale, and I say, well, it works, so I do more of it. So again, measurement not as an engine for continuing and fostering further change.
So we talked about
too much.
NGOs, we talked about application. The one you know is Merck, but you don't know about the other one like HP, Goldman Sachs.
But they're available
in the Positive Deviance.org, I think.
Yeah. And case studies are around.
Yeah, in the Harvard Business Review case. And then I asked, what are the differences compared to a classical consulting approach? And you looked at me and say, I don't know, let's ask them. And you say, no more question, Gwen. Let me talk with them.
To ask them. We have to ask you.
So what do you think that are the classic consulting approach, and what are the differences between this approach, positive deviance approach, and the one we could use on a daily basis or seeing in our companies?
I wish. What's the trick? Yeah.
I guess certain consultants like to basically go and use a methodology that's something that they've previously designed, developed, and possibly even used. And once they've got that sort of proven and tested methodology, they like to reproduce it as often as they can. It sort of gives them a feeling of expertise and knowing what they're doing. It seems to me that in your method, you go there without any predefined approach whatsoever, and you try and figure out actually on the ground what the problem is to begin with, and then how you can maybe find those exceptional cases that differ from the standard rule. I think it's sort of it's the going an empty-handed approach.
Yeah, you have to come with a blank slate. Although people want you to do it. I mean, you, as a consultant, you're supposed to make things work. That's your job. But so there's a lot of preliminary steps that have to be carried out with the leadership, the people who hire you, to explain that this is not business as usual. I am not here to tell people what to do. I don't have the solution, because the idea is to find the solution together from within. And so they need to agree to this very different contract, because otherwise, of course, you cannot do your job. And so that's one different. I would say in terms of your arsenal of tools, I still have some tools I use, but evidently very different. So you can still use some of the tools that have worked in terms of dynamics, group dynamics, in your facilitation. You have things, it's highly participatory, so you probably have your own intuition. No, you can bring your intuition, your own talent to this. I'm not saying that you just like, guys. No, because you actually, you use your own, some of your tools, but maybe at the first step is first to really look around. I'm sure you do that too anyway. To sort of understand the situation and do a lot of observation instead, and you're not very directive. But you can use some of your tools, evidently.
This is a deviance from what? It's deviance from a rule.
Yeah, from the norm. Yes.
From the norm. So
we need to do.
Deviance would be the third step. First step, you have no norms, then you set up norms, and then positive deviance help you, let's say, fine-tune the norms.
No, I wish I had. That was so visual. So you use PD when you have variation in your data. You start with data, absenteeism in one prison, and you make your data, and you see that so many people are in the middle. So, but then you find that, let's say this is positive, this is negative. Most of the guards have lots of absences. I'm taking the, because it's a sign of stress. You may use, there may be an issue with your companies about absenteeism, people who are sick all the time, called sick because of the pressure they feel in the kind of environment company or businesses put their subject their employees to. So you look at your data. In your data, you have variation. You have people, few people who are really not doing well at all. I mean, they're absent all the time or to the limit. And then you have the middle people, the average people who are absent, let's say, in the case of, I haven't seen the data from the prison, but we start with data that are in the middle. And then you have a few people, the outliers, who are actually, and then positive deviants are very few in terms of data. And so sometimes they're not statistically significant, but they're very significant because when you have to find them and say, well, what are they actually doing? In the case of the garbage collection company in France, they look at their teams of garbage collectors that work in teams, and so they looked at the data on work on the job accidents among the different teams, and they were able to identify, so many were there, they had lots of accidents, I don't know what, but there were few teams who had no accidents. So finding out what they're doing differently was very important. So do you understand? Actually, you start with data. You need data. Because you cannot just say, well, I think this person is different. It's always, we want to be, it's actually quite scientific in the first analysis. If the data are not there, you create the data with the people. In Vietnam, we didn't have data on actual nutrition status of the children. So we were lucky that it's a very literate population. So we trained them, and the people, actually with their children, and together then, so you create your baseline. And then together looked at what it means. What do we have here? And well, we're just amazed that 65% of the children are malnourished. So what does that mean? And so starting the discussion and then looking at those few people who are different. Can we learn from them? I can tell you, this is so, people are, talk about mobilization, because people are, they have people coming in saying, we're going to try PD approach. That's another thing I want to talk about. We're going to try this new thing is coming in. And people are tired, say, what is this? So I don't have a business plan. I have not patented the approach. I could, because we decided to be open source, and we cannot really have a business plan, because if we say, oh, this PD approach, we market it, we become like everybody else. We're here to sell our shebang. So what we do everywhere. When we work, if you work with this approach, you have to say, okay, I'm going to learn more about it. This is just, a little, just to expose you to it. You said in the preliminary steps, you tell, first of all, what the problem you see, senior management, what are the problems? Do you think solution maybe existing in your organization? They may say yes. And then you said, we're going to ask you to do something. Me and my colleague or myself, I will come and talk to the widest representation of your organization. So it's a lot of people, sometimes 300, 400 people. And you can invite me to talk about what this approach is about, finding solution from within. And then you, CEO or Chief Medical Officer, you are going to tell them, you are going to decide if you want to use this particular approach to address some of the problems we have in our organization. So it takes guts. Not all CEO or whatever, senior manager will actually say, you're the workforce, you're the people, and we have this problem here that we want to solve. Do you think, would you like to try this, which is, that said, these guys came and told you that the solutions are here, we just have to discover it together. And you and the CEO leave the room. This is called the invitation. This is the only way we're not caught into just selling I can sell my wares, right? I mean, I can sell my PD expertise, PD as another method. But we can't do that, because that would completely jeopardize the whole process. It's like it would be imposed from the senior leadership, say, oh, we're going to do PD. Let's use PD for this problem. So people are not part of this. But if the people decide, that changes everything from the get-go. If middle management, well, they were reluctant. Well, in Merck, Mexico, because the only example I know better, the 41 district managers, they were never asked before their opinion either. They say, what's this? Because they know corporate top-down things. They say, oh, they were not, they were afraid. They say, why? They're asking us if we want to try this. We're in a big problem. We have big problems here, but leadership is telling us what we think, what we want to do. There's a trap here. So one of my colleagues talks about this. I'm not familiar with this, but that in companies, managers want to keep the status quo. There are incentives. There are many reasons why they don't want to rock the boat. There's advancement. Because they're traditionally are supposed to make things work, right? So there's it's scary. So for them first to be willing to get this invitation I'm talking about and respond to it. So in the case of Merck, not all of them stayed. Maybe half of them said, okay, we're going to try. And they did, and it turned out to be successful. But so that's what we do. We do an invitation. And people have to take it. If they don't want to do it, the CEO say, okay, I'm not going to do it.
It's a conversation. So what are the key questions that you would have in mind and you want to ask and share with Monique and with us?
It's a bit... If you're interested, you can read about it. There's a lot of literature on this positive deviance approach. There's a lot of work done in positive deviance in research in many fields. It's a very popular approach in research.
So do you have any areas, you talked about a lot of different places where it worked really well. Do you have any areas where it didn't work? And do you know why it didn't work?
Yeah, so business. Business is difficult. It's a big challenge because, again, it goes against, it's very different. It's a paradigm shift because as an expert, you become a learner. So you have to shift for this particular approach that many people are not willing to do. Companies will not do this because it's soft. It's dangerous because, again, you empower a lot of your staff, so you don't control everything. But it will pay. It'll pay wonderfully. But it's a danger. So business has been an area where, and because of the consultancy world where they say, well, I mean, when I get consultancy job, I want to maintain my relationship with my client. And with this approach, in a way, you disappear because it actually works. Well, so maybe they can, again, it's contextual. So one of the things about the good news about that is you could, it works somewhere because it's contextual. One of the missed opportunities for Merck, the global Merck community is what, because they didn't go through what they did there was not translated in other part of the Merck business, but because it was contextual, the solutions were really Mexico-based, has to do with relationship, to do with the cultural context. And what Merck missed is the opportunity to take the consultant and bring them to another area where they would say, well, context matters. And local indigenous solution or strategies are very important. Though they missed it completely. Because, this is our marketing thing, and we do it across all the offices. And as you all work in a very multinational, interdependent world, we all understand that culture matters. And so, to answer your question, business is an area where there hasn't been a lot of example of use of this approach because of, it can compromise your business plan.
Were successes or not?
Yes, there were success. One didn't work because they did what happened is if something works, people are very busy. The time frame for people, there's a lot of, they want to do things, we didn't talk about time frame. Because we look at sustainable results, we need at least 2 years, right? Because things are going to change, but you want to make sure that it's sustained. But sometimes management doesn't have time. A lot, even in development too, the founders, they want quick results. Because this world here, or some of our world here, they go very fast. They want quick results. I forgot what I wanted to say. So, so then they won't spend the time to do this.
My feeling is that it needs time.
Yes.
And when you're in business and when you're a consultant will ask for quick results, short time, and très peu d'argent dépensé.
Oui, c'est ça.
So, generally speaking, they would prefer quick and visible methods that give the visible results, even if it doesn't go really deep and obvious. Who really does matter if it doesn't go very deep at the level of the board? That would be the question.
So it is one of the challenges with this approach. I mean, it's not easy. It's a simple concept, it's simple steps and methodology, but the processes and the way to work is very challenging, particularly with this time frame, because it's labor intensive. But when it works, it's like the ketchup bottles, you know, nothing comes, and then all of a sudden it's like you're overwhelmed. It's the same. We say to go fast, you go slow. But once the click, once the things happen, it's like sometimes overwhelming. But it is one of the challenges, particularly in business, where we haven't seen. That's why I'm looking for. There will be hopefully a case study of this application in France, and you may be doing it without knowing it too. Yeah. I mean, this case in France is one of your colleagues from HEC-Oxford who applied this without knowing he was doing it, but very successfully. So it can be done, but it has a lot of challenges.
There's something else. It surely can be done, but obviously it comes when you have, I would call lethal problems in the company. I mean, big problem for the company, very, very big, qui vont jusqu'à le problème de la survie de l'entreprise.
Yeah.
You understand what I mean?
Yeah, survival, yeah. Chronic, yeah.
Like
No. It's not applicable. There are many other methods that are perfectly applicable for short-term, just improvement. As you mentioned, a very good point, that it is about survival. It is chronic problem that bringing the company down. They're cultural, they're behavioral problems. They're not technical problems, because experts can come and fix a problem, a technical issue, very quickly. But it's a problem that have to do with organization, the culture, the conflicts between different groups. But that affects the bottom line, that surface in some data. You have to have data because you want to, yeah.
We wanted, and the choice of the HEC-Oxford Master was to bring positive deviance in the lessons, because the results are quite amazing. It means like when Harvard came after the Vietnam, it was 65 to 80% behavioral change on a 5-year range, which is amazing. And when we discovered positive deviance, the first results came into less than 6 months. But of course, when it's about infant malnutrition, getting the first 100 grams is more easy to get than to get a sustainable. But we've got results. Richard Pascal, an Oxford fellow who is teaching at HEC-Oxford, he was the one who wrote the chapter about Goldman Sachs, about Merck. We've got an article about Genentech with the biotech. Oh
yeah, it was a rollout. Yeah, they took it and they rolled it out, and that doesn't work.
It didn't work, but there were positive deviants. There were two sales reps who sold 20 times more than the 240 other people, and they discovered how. Then they said, we need a consultancy group to spread it, and it didn't work.
It didn't work because it's not invented here. Yeah.
But we've got, as Monique says, like Goldman Sachs did it without knowing it was doing. HP, you know the case at HP. Greg, who is a sociologist, I think it lasted 1.5 year mission, but he's got amazing and sustainable results. And it's another way to see things. Yeah. Only in life and death situation that we could get in companies more than we thought. Yes, and
in different ways.
What are the other questions that you've got? Because I mean,
somebody.
Yeah.
That's okay. On peut parler français, peut-être bien. Je sais pas. No.
It's 100% English for Oxford and Harvard guests over here.
My question will be going against the politically correct. Do you consider that as a positive deviance, like did such a Mediapart or Charlie Hebdo, for example. Is this behavior is position of the press or the media positive deviance culture or
Oh, I don't know. I don't know.
I don't know. You know.
There's a function in society for this kind of satirical view of the world or events, people, everything sacred, what some people consider sacred.
Positive deviance means different and efficient in a specific context. So
yeah,
facing problems.
Yeah, specific problem.
Yeah.
But definitely, I was thinking we could look at what happened last week. Unfortunately, Greg was not here, but we were all shaken, and I was thinking, how can we look at this with a few PD lens? There's many different type of issues, but beyond the words, we're all turning into action. I'm trying, because I don't know anything. I don't live in France, so I'm an outsider a bit. But I was thinking the parallel between the use of the positive deviance in Denmark prison to where they're trying to rehabilitate prisoners by improving relationship between prisoners, inmates, and prison guards. When we think of what has happened here and how prison maybe in France are more punitive than rehabilitating, there may be something to do that. By the way, I hope I mentioned that the person who did the work in Danish prison, and PD has become the flagship approach for all the prison in Denmark, is actually a graduate of HEC-Oxford management program. Consulting for Change. And it's been very successful. And now he has created a network in Europe where he wants to promote the use of this approach for many different problems. It's been used in the Netherlands too with disenfranchised students. So again, to go back to our current situation, are there communities where cars have gone in flame, where there are pockets of what we call bright spots? Are there places where the violence doesn't happen? Are there community or association or groups where, let's say, Muslims and Jewish communities are working together? Have we looked at those incidents of positive deviance, of people who are in extreme situation themselves? So we're not looking at the headquarters in Paris. We're looking at people who are in the middle of very difficult situation, and yet, this is what we always say, and yet they're able to overcome, to deal with this. And who should be looking at that? Not just the politics, but the other people, the community who live in those suburbs or live in those areas where the violence is highest, or the disenfranchised young people are living, to see those bright spots, and how you then leverage, how do you try to learn and spread. It's viral. It's a very bad analogy, but it's a viral type of process. Learning and then spreading. The facilitation happened, you're a catalyst, but you invite the people with the problem to go and find out what works. So bring them to go and meet their counterparts who are successful at managing anger, at being able to live together with another group, because we call unity. I say, well, unity. So how does that translate in everyday life? How do we look at the other? And multiplying example of those experiences and strategies people or groups develop to look at the other. It was during the first Infata. We didn't do it, but I had put together the list of Palestinian organizations that work with Israeli organization, And one of them, there is an association of Palestinian and Israeli parents who have lost children from the other one. You kill my child, you kill my child. And they're working together. And I always thought, well, this is coexistence can happen. And this is the worst case scenario, where you actually, the others have killed my own blood and flesh, and yet they're working together. And this is a type of thing where you say, well, what if we learn, let's ask them, how is it possible? How do you do it? What are the strategies that enables you to actually work together? And that's it. I mean, meaning that you can look through those lenses at different types of problems. But for what happened, but because you mentioned Charlie Hebdo, looking at, those bright spots in different sectors, prisons, I don't know. Because it's true those guys were in prison and were actually radicalized in prison. So are there prisons, or are there instances in prison, specific prison? So a prison is a community, it's an organization, it's very controlled. That's why this example from Lars Thyssen in Denmark is so interesting, because everything is coded, and behaviors of the inmate, behaviors of the guards are very prescribed. And yet, if they stay like this, you know, they don't communicate, and how they've been able to do. It's only 3 prisons, but they've done. Now that you have guards that play soccer with, they play football with the inmates. Yeah, and they do things. But again, the way it happens was, you know, very interesting. But it's possible. Oh,